We're going to talk about carpal tunnel syndrome. This is the model of the hand, where there are 8 bones in the wrist joint. They're called the carpal bones. And on the surface of the carpal bones, there's a big ligament, which then converts this area into a tunnel. And through this tunnel, you have 9 tendons that move the fingers. And there's also a big nerve called the median nerve, which gives you the sensations to most of your fingers. The carpal tunnel is usually a very, very tight tunnel in a normal individual and is very easy to inflame the median nerve within the carpal tunnel just by doing day-to-day activities. I see carpal tunnel syndrome in patients of all age groups and both sexes, and this condition can be mild, moderate, or severe. It may also be for a short period, or it may be for a long time. Carpal tunnel syndrome is associated with pain that's hard to localize, even though the carpal tunnel is the median nerve is compressed in the carpal tunnel. The pain is not only localized over the carpal tunnel, it can cause pain down into the hand with pins and needles, particularly at night. That wakes patients up. Waking up at night with pain or pins and needles is a very characteristic symptom of carpal tunnel syndrome. It's also very common for patients with carpal tunnel syndrome to get pain affecting the whole arm, sometimes all the way up to the neck. This is called referred pain, which suggests that if there is a problem in the wrist, pain can occur in the shoulder, elbow, wrist, or hand. Depending on whether the symptoms are mild, moderate, or severe, there are 3 different conventional treatment options. First of all, you can use splints on the wrist to keep the wrist rested, particularly at night when you go to bed, for 3 months. And in the mild cases, this may be sufficient to cure the condition. About 50% of patients who try splints in this manner get cured. The second conventional treatment option is to do steroid injections into the carpal tunnel, and this definitely helps the symptoms, and in most cases symptoms are helped for up to 1 year. There are a number of cases, of course, who come back with reoccurrence of symptoms within the year after an injection. And hence a third conventional treatment comes into play in these situations, which is surgery. Surgery is very commonly done. The incidence of carpal tunnel syndrome is 1 per 1,000 population, and probably 1 per 2,000 patients end up requiring surgery. So we do it under a local anesthetic, and I do a small keyhole incision about 1.5 centimeters long as a day case procedure. The incision is closed with dissolvable stitches, and you have a dressing, and the area is left dry for approximately 2 weeks. Pain relief is immediate following surgery. However, if you have a numbness in your fingers, that can take a long time to recover. Finally, if you have a lot of muscle wastage from a severe carpal tunnel syndrome, that may never recover. And in some cases, if the thumb is weakened by the carpal tunnel syndrome, then further surgery using tendon transfers can be used.